Book 1, Unit 1, Hospital Departments. Exercise 5, page 5.
Heartland Hospital. Heartland Hospital's dedicated staff is here to serve you. Our first-class departments include Pediatrics, provides healthcare from birth to adulthood. Chair, Dr. Richard Collins. Obstetrics, cares for women through all stages of pregnancy. Chair, Dr. Susan Meeks. Radiology, creates X-rays and CT scans for all departments. Chair, Dr. Thomas Locke. Pathology, tests samples for all departments. Chair, Dr. Laura Howard. Surgery, performs everything from routine procedures to organ transplants. Chair, Dr. Rachel Silver. Cardiology, investigates and treats all heart problems. Chair, Dr. Paul Sarton. Dermatology, cares for everything from warts to skin cancer. Chair, Dr. Jeff Schmidt. Orthopedics, provides bone and joint care. Chair, Dr. Catherine Newland. Emergency, treats patients in life-threatening condition. Chair, Dr. Douglas Green. Additionally, our pharmacy can fill prescriptions 24 hours a day, 7 days a week.
Unit 2, Hospital Staff. Exercise 5, page 7.
Heartland Hospital Staff Directory. First floor. Dr. Paul Sarton, cardiologist, surgeon. Office 100. C4, heart disease, heart surgery. Dr. Lydia Greenwich, anesthesiologist. Office 101. C4, surgery pain relief and preparation. Dr. Richard Collins, chief pediatrician. Office 102. C4, children's health. Dr. Ann Harold, obstetrician. Office 103. C4, labor, pregnancy. Dr. Thomas Locke, chief radiologist. Office 104. C4, X-rays, CT scans. Carol Howard, lab technician. C4, test results. Second floor, Dr. Rowan McNeil, general practitioner. Office 202. C4, general medicine. Carol Simmons, NP, head nurse. Office 203. C4, nursing schedules. Dr. Charles Thiel, pharmacist. Office 204. C4, prescriptions.
Unit 3, Hospital Equipment. Exercise 5, page 9. Medical supplies. Please keep everything in its proper place. Large items such as wheelchairs and pressure mattresses are at the back of the room. Supplies for patient rooms, such as gowns and bedpans, are on the left. Syringes are on the top shelf on the right. Dispose of used syringes in the sharps containers. Gauze, latex gloves, and other examination supplies are under the syringes. Dispose of these items in a biohazard waste container. If any items are out of stock, please submit an order form to the front desk. Oxygen tanks for patient rooms are on the second floor next to surgery. Unit 4, Parts of the Body 1. Exercise 5, page 11.
Journal of Athletic Medicine, Issue 84. Common Sports Injuries by Dr. Mark Robbins. Athletes deal with injuries on a regular basis. Below are some of the most common sports injuries. Ankle sprain. This is the most common foot injury. It occurs when the foot rolls in a twisting motion. Knee sprain. This can result from a blow to the knee or a sudden twist. There could be pain throughout the leg. Elbow sprain. An unnatural arm movement can cause an elbow sprain. Pain can be felt through the arm to the wrist or even the hand. Shoulder dislocation. A hard blow can knock the shoulder out of place. This is very painful. Hips can also be dislocated. Fingers and toes. These appendages are often jammed or broken.
Unit 5, Parts of the Body 2. Exercise 5, page 13.
Jefferson General Hospital. Patient name, Doug Robinson. Sex, male. Age, 27. Physician, Dr. Robert Moody. Time, 9:42. Incident or reason for ER admittance. Automobile accident. Apparent injuries. Head and neck. The patient suffered minor head trauma and may have a concussion. There is no visible injury to the neck. Torso. There are several small scratches on the chest and waist. I observed bruising on the abdomen and the rib cage. There is no damage to the legs or groin. Posterior torso. The patient complains of pain below the right shoulder blade. He also has a deep cut on the small of his back. Arms and legs. The patient's arms and legs appear in good condition.
Unit 6, Parts of the Body 3, Exercise 5, page 15. Patient Assessment. Name, Molly Roberts. Sex, female. Age, 14. Primary Physician, Dr. Joseph Nelson. Parent, Guardian Signature, Pamela Roberts. Home phone, 555-8889. How did injuries occur? Bicycle accident. Describe injuries. The patient has no severe head trauma. There are minor scrapes on the face and a small bruise on her jaw. The patient has one deep cut on the forehead. There are two minor cuts between the right eye and eyebrow. The nose appears bruised and the upper lip is bloody and swollen. There are scrapes on her left cheek near the left ear. Unit 7, Respiratory System. Exercise 5, page 17.
Hyde's Medical Dictionary. Illnesses of the respiratory system. Asthma. Asthma is a chronic disease of the lungs. It involves inflammation of the bronchial tubes and other airways. This causes wheezing, coughing, and difficulty breathing. One way to treat asthma is to inhale medicine using an inhaler. Emphysema. Emphysema is a progressive respiratory disease. It is the result of bronchial tube damage. In emphysema, the alveoli lose their shape and functionality when the person exhales. As a result, less oxygen is allowed to enter the bloodstream. Smoking tobacco is one of the most common causes of emphysema.
Unit 8, Circulatory System. Exercise 5, page 19.
How the circulatory system works. The circulatory system carries oxygen in blood to all parts of the body. Blood begins its journey in the heart, which beats to pump it to the rest of the body. Valves control how blood moves through the heart. Blood picks up oxygen in the lungs by traveling through the pulmonary artery. It then leaves the heart through the aorta, the body's largest artery. Blood flows throughout the body in arteries. At the end of arteries are tiny capillaries. Here oxygen moves to parts of the body. Blood without oxygen returns to the heart in veins. The largest of these, the vena cava, empties into the heart's right atrium. Then the cycle can begin again.
Unit 9, Digestive System. Exercise 5, page 21.
Abdominal pains.
Dear Dr. Diane, I've had persistent pains for 2 days. At first, there was a dull stomach pain. Lately, the pain has become sharper. I'm a little stressed out because of family and work. Friends say it might be an ulcer. Is it that serious? Painful in PA.
Dear Painful in PA, always take persistent pain seriously. Persistent pain could mean an ulcer. Pain between the heart and stomach might mean an esophagus problem. Pain lower in the abdomen could mean appendicitis. The appendix is between the small intestine and large intestine. It sometimes becomes inflamed and causes real problems. It's part of the digestive system, but its function is unknown and it can be removed without any consequences. Your doctor may want to perform a colonoscopy. That will check your colon and intestines for any serious problems. Dr. Diane.
Unit 10, First Aid, Exercise 5, page 23. Basic First Aid Techniques. In a medical emergency, always call for assistance first. The following are basic steps to take to help an injury victim before medical help arrives. Assess the victim's condition. Give him or her plenty of space. Prevent shock by elevating the legs and covering the victim. Apply pressure to lacerations or other open wounds to stop bleeding. If bleeding has stopped, wounds should be cleaned and wrapped in a bandage. Cool minor burns with running water. If the victim's pulse or breathing has stopped, CPR or rescue breathing can be performed. Be sure to clear the victim's airway before rescue breathing is carried out. Unit 11, Common Abbreviations. Exercise 5, page 25.
Scottsville General Hospital. Patient evaluation. Date, April 12. Patient name, Christine Gordon. ID number, 6612431. Sex, female. Physician, Harold Downs, MD. Attending nurse, Susan Smith, RN. Time, 23:15. Patient condition, stable. Patient vital signs, T, 100.6 degrees Fahrenheit, as taken by oral thermometer. HR, 81 beats per minute. BP, 140/90. Respiration, patient COSOB. Notes, XR shows no acute lung disease. Blood sugar levels are WNL. OE, patient appears to have high levels of anxiety. The patient is a smoker and has a high stress profession lifestyle. DX, the patient likely has HTN, but further testing and lifestyle analysis will be required. RX options will include diet, lifestyle adjustment, and medicine.
Unit 12, Measurements. Exercise 5, page 27.
Medication list, procedures for Carlton Avenue House. Patient medication chart. Pascale D. 40 MEq KCI by mouth twice a day. 1 milliliter, 1 cc, insulin injection via abdomen after dinner. Holmes F. 2 GTT saline solution in each eye every morning. Paulson G. 2 teaspoons of fish oil by mouth every afternoon. Roberts R. 1 tablespoon of dextromethorphan, DM, by mouth twice a day. Take for 5 days or until cold subsides. 2 grams omega-3 by mouth every morning. Francis H. 20 milligrams fluoxetine HCI by mouth at breakfast. Harrison K. 500 mcg cabergoline by mouth every night before bed. 1 tablespoon of fish oil by mouth every afternoon. Tracy A. 2.5 ounces medicinal toothpaste every morning and night.
Unit 13, Administering Medication. Exercise 5, page 29. Patient, Catherine Gates. Medical history. Medications. 0512. Ms. Gates came in complaining of a rash. She received a topical ointment to administer to the affected area. 0517. Ms. Gates was admitted to the hospital with serious dehydration and breathing trouble. She was given fluids through an IV. She was also given a 200 milligram dosage of steroids. The route of administration was an intramuscular injection, IM. 0519. Ms. Gates' persistent illness has been caused by an infection. Serious complications have arisen. Antibiotics are being given through subcutaneous injections and PR. 0526. Ms. Gates was discharged today. Her physician prescribed antibiotic pills to be taken for 2 weeks. These should be taken PO and can be swallowed or absorbed sublingually. Unit 14, Describing Frequency. Exercise 5, page 31.
BID, take twice per day. TID, take 3 times per day. QHS, take at bedtime. AC, take before meals. PC, take after meals. QOD, take every other day.
Heartland Hospital, Ward 4F, Patient Medications. Bill Foster. Give Mr. Foster 200 milligrams of heart disease pills, TID. These should be taken PC with water. Jill Richards. Mrs. Richards can have ibuprofen PRN. It should be taken AC though, so give her a snack with it. At night, she should also take her antibiotic pills QHS. Carrie Edmonds. Ms. Edmonds needs steroid injections BID in the morning and night. Her IV drip should be exchanged QH. Alex Davis. Mr. Davis must have his injections frequently QID. If his heartbeat is irregular, give him a 25 cc injection of lidocaine stat and notify the physician on call right away. Lucas Simpson. Mr. Simpson requires hydrocortisone QOD.
Unit 15, Maintaining Hygiene. Exercise 5, page 33.
From Bernard Tobin, Hospital Director. To all staff. Sent Saturday, November 15th. Subject: Hygiene Standards. Attention hospital staff. The flu season is approaching. I want to remind everyone of the importance of maintaining strict hygiene standards. Contagious new virus strains and drug-resistant bacteria cause problems every year. I do not want that happening here. Regular hand washing with antimicrobial soap is imperative. All surfaces must be cleaned with disinfectant according to the maintenance schedule. We must always store antibiotic drugs in the proper cabinets. Biohazards should be mindfully disposed of. Should drug-resistant flu strains appear, we must quarantine all infected persons. To avoid transmitting further infections, no one will be allowed in quarantine areas without a face mask. Thank you for your help. Bernard Tobin, MD, Hospital Director.
AVN Pharma Education.